Good afternoon and welcome to Webinar Wednesday. Today we are joined by Kelly Starman, Chief Marketing Officer at PartsSource, Kevin O'Reilly, PIRG's Right to Repair Campaign Director, and Wesley Reid, Director Technology Management ENTECH at Banner Health. Webinar Wednesday would like to thank our sponsors, PartsSource. PartsSource is the leading evidence-based B2B vertical marketplace and supply chain software platform trusted by the healthcare provider and supplier ecosystem to improve essential clinical operations, staff productivity, costs, asset uptime, and supply chain resiliency. Today, they help more than 5,000 hospitals and more than 15,000 clinical sites achieve sustainable savings and efficiencies. PartsSource transforms the way you work to ensure that healthcare is always on. Visit partsource.com for more information. Just a quick reminder to save the date for our Spring MD Expo. We're headed to the Woodlands Waterway Marriott Hotel and Convention Center in Houston, Texas, April 11th to 13th next year, 2023. Please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more details, please visit mdexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following question. PartsSource, our sponsor today, is headquartered in Ohio. So what is the name of the Ohio-born movie director that has Saving Private Ryan, Jurassic Park and Jaws credited to his name? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Kelly Starman, Kevin O'Reilly and Wesley Reid are our presenters today, and we'll be discussing reclaiming our right to repair, understanding challenges and taking back control. So Kelly, you may begin whenever you're ready.
Thank you so much, and good luck to those t-shirt winners out there. That's a great little trivia question. Greetings to our PartsSource community members. My name is Kelly Starman, and I'm the Chief Marketing Officer here at PartsSource. I'm really excited to be having this dialogue with all of you today on reclaiming our right to repair. The objectives for this session are to share details around right to repair, the background of the movement, and the implications for those of us in health technology management. Secondly, we want to learn from the challenges, real-life scenarios, and actions that are being taken by HTM leaders and their organizations today around this topic. And then lastly, we want to work together to identify opportunities to become an active participant in the right to repair movement so that we can all work together to support patient safety and quality care. I am joined, and I'm so thankful that they're joining us, by 2 really amazing leaders and advocates in this area. My co-panelists today have firsthand experience speaking about right to repair and advocating for change. They've collectively represented their organizations and the industry in this area, and they're looking forward to sharing their insights from their own experiences with you to help increase your understanding and support your journey. So I'm going to turn it over to each of you to briefly introduce yourself, and then we'll get into the conversation. So Wesley, why don't we start with you?
All right. Well, Wesley Reid, thank you for having me on. I'm a retired Army Master Sergeant who spent 20 years as a biomedical equipment technician, servicing equipment around the globe in war zones and elsewhere. My career culminated as the Army Service Lead for the Department of Defense Biomedical Equipment Technician Training Program at METC, and as the Army's appointed enlisted subject matter expert on healthcare technology management. I hold the CHTM, CBET, and CRES certifications. So from a certified biomed standpoint, I feel like I do have a leg to stand on when I'm talking about right to repair. And I'm a right to repair advocate, and I hope you are too.
Great, thank you. Kevin, over to you.
Yeah, thanks, Kelly, and thanks y'all for including me. I'm really excited to talk about this issue. It's a really important one. My name is Kevin O'Reilly. I'm the Right to Repair Campaign Director with PIRG, which stands for the Public Interest Research Group. We're a nonprofit, nonpartisan public interest advocacy organization, and we operate trying to win campaigns around consumer protection, public health, good governance, and the like at both the state and federal level. And so we have been working on the right to repair issue across industries for the past 5 or 6 years and have become one of the leading groups doing so. And one of my focus over the past 3 or so years has really been on medical devices, working with hundreds of biomeds and ISOs and HDOs from across the country, trying to make sure that they have the materials they need to fix medical equipment when it breaks so that they can deliver the best care possible. So excited to dig in and talk a little bit more about what's happening and where we need to go from here.
Wonderful, thanks. And I think what's really interesting about this discussion is that we have two very different perspectives around the same topic. And so it'll be great to kind of hear how you both kind of work together, and then also how, from your vantage point, what opinions you might bring where there might be some differences. So I think we should just start at the beginning and define for the audience, what is right to repair? What are some of the most significant issues that you and your team have faced with regards to this issue? And then what are some key milestones that you've seen in the movement? And I think, Kevin, why don't we start with you to really help us set this up?
Yeah, absolutely. And so, like I said, right to repair is about making sure that we can fix our stuff when it breaks, broadly speaking, whether that's a cell phone, a tractor, or, a ventilator or a dialysis machine. It's about returning kind of that agency of ownership back to the people who do own the equipment, because over the past couple decades, we've seen software work its way into nearly everything we own. And in the process, manufacturers in many cases have restricted repair by limiting access to necessary software, to manuals, to specifications, even to parts and other things. So medical right to repair is about making sure that hospitals, that independent service organizations have access to those materials, those repair materials, on fair and reasonable terms, and passing laws to get that done. I'll turn it over to Wesley to talk a little bit more about what it's like in his department and kind of the first-person HTM experience.
Yeah, I think it's inevitable that every director and even technician, on and up and down the food chain from the servicing side of the house, at least in the hospital organization, faces these issues every day. And whatever they're ordering, whatever their service they're trying to come in and have done, even with stuff that's under full service contract, with all the that's going on in the world today, sometimes the OEMs are still not able to provide the service because they're waiting on supplies and parts and things like that too, which with the current system, the way it's set up, it's not advantageous to not allow us those parts and services before something happens like the pandemic. It just shows the weakness of the system that we have in place right now. Another thing is we have remediation efforts going on right now from one manufacturer. They're on site, and while part of their narrative is that they don't want untrained and unqualified personnel working on the equipment, as part of the patient safety, which I think we can all agree on. The team that's here to remediate this equipment right now, only one is a trained biomed. I ask them every time they come in, and typically the other technicians come from another company that helps the OEMs with their FDA recalls, and they're not true biomeds. They are trained on this one remediation effort, and so then my technicians are going to have to go in afterwards to really validate that equipment is ready to be put back into patient use. And so, there's many different things from delay of service, to non-service. I just recently also had another issue where on 2 sterilizers, they were telling us they had 2 months, they were giving us a 2-month lead time on a repair, not even on, getting a PM done or anything like that, on a repair. And then when I was told that, because we were a non-contract customer, that's why it was taking that long. Obviously, departments, if you just allow that and you don't push back and you don't, ask to speak with their service managers, then that's what you're going to get.
Mm-hmm.
And, I think those kind of 2-month lead times to fix equipment is just unacceptable for patients, for hospitals, right? If we really came to this campaign seeing the impact of the pandemic, right? I think the pandemic really rose this issue to the fore, in the fact that there were ventilators, there were dialysis machines, there was imaging equipment that was sitting broken and unfixable because a combination of the necessary repair materials weren't available, and also there were travel restrictions, right? The last thing manufacturers wanted to do is send people from COVID hotspot to COVID hotspot, which is understandable. But I think that made a real case for the resiliency aspect of right to repair, right? Of making sure that the people who are on site, who are trained, who know what they're doing, folks like Wesley and his team have what they need. And so over the past few years, just to quickly touch on kind of the progress of the movement over the past few years, I think for one, hundreds of biomeds. I worked with over 500 who signed a letter right in the wake of the start of the pandemic, who were calling for reduced repair restrictions as a response to that emergency. And since we've seen how their voices and their stories are so important, right? They've helped us to introduce legislation at the federal level. Senator Ron Wyden introduced a bill back in the fall of 2020 aimed at kind of solving this problem for the remainder of the emergency declaration. They have worked to, in the states as well, folks like Nader Hamoud, who was going to join us, unfortunately couldn't, but also, Alir Kaloli and Paul Kelly and others at ACCE who, brought this before their state legislators and tried to put this forward, brought this before their hospitals, before the California Hospital Association, all of which supported our bill there, that made it through a couple policy committees, but unfortunately died in a backroom part of the process. And since, that has happened, there have been other bills introduced in the states. One in Arkansas actually passed one house of the legislature there in the state before dying in the other one. There have been defensive efforts around, the medical device user fees amendments and making sure that remanufacturing doesn't get overly broad so that service activities are included in that. But I think what we're really looking to now is planning for 2023 and figuring out a way that we can continue to build that support from the biomed to hospital to ISO level, but then turning that into concrete change through legislation.
I think that's great. And it really kind of leads me to this next question around support for right to repair, and there being kind of two sides of this, one being the manufacturers and the other being the providers. And so I want to spend a little bit of time trying to understand the manufacturer point of view on this. And Wesley, maybe we can start with you here. What are you hearing and seeing from manufacturers around this idea of right to repair?
Well, I would say there's what the manufacturers communicate and what we feel, is their impetus for fighting this legislation that would allow many technicians to repair their equipment and keep it serviceable and not in disrepair. I believe what they communicate is that it's for the safety of the patients because their technology is too complex for anyone but OEM trained technicians to complete that work. I know that not to be the case because I have OEM technicians come into my hospital all the time, everywhere I've been. And I even see OEMs, advertising for new technicians, and their minimum qualifications are high school, education, not a 2-year biomedical engineering degree, not the military BMET program, not any of these other programs. Because they know that once they give them the service keys and the codes and everything like that, and they're training on the specific modalities, they don't need any other education. They don't need certification through ANI or any of the other, and so that's kind of from that side, taking kind of away from their argument as far as, the people that are, really, they're going to college, they've got their certifications, they're working in a hospital. And so they see where the rubber meets the road, where the patient meets the equipment. These technicians are the ones that are doing it on a daily basis. And I would say that from the manufacturer's side, it's more about the bottom line, and they will tell you it's not that. And really, I can't take myself away from thinking that is it. It's about the money. The more things that we repair, the less things they're going, the less new models they're going to sell. the less repair activities they're gonna be able to bill for and charge for.
Mm-hmm. Yeah, Kevin, what are you seeing from a policy standpoint in terms of how manufacturers are engaging around this topic?
So we hear a lot of the same arguments, from their representatives, whether it's, on their own behalf as lobbyists or through their industry groups, of, kind of positioning it as a safety issue. And to Wesley's point, right, first of all, these folks who are doing this work are qualified to do it. But also, right, I think it's really important to look at the facts and look at the report that the FDA issued back in 2018 on third-party servicing, which came to a few conclusions. For one, they found that many OEMs and third-party repairers are providing high-quality, effective, and safe servicing of equipment, but also spoke to the importance of having non-OEM repair. They said that the continued availability of third parties to service equipment is critical to the functioning of the U.S. healthcare system, right? So this needs to keep happening, or else patients are going to be the ones to suffer. And I think, one really encouraging bit of testimony we saw from Representative Neil Dunn of Florida during the remanufacturing discussion during the MEDUFA kind of process. He himself is a urologist. He runs, some cancer treatment centers out in Pensacola, Florida. And what he said is he thinks that the reason that these repair restrictions are happening is because somebody in a boardroom in the C-suite somewhere was looking and saying, we're leaving way too much money on the table when it comes to repair. We need to do this, right? And he talked about how for his patients, if it turns out that one of their radiotherapy machines goes down on a Friday, and they can't get a manufacturer technician until Monday or Tuesday, the literature shows that patient will have adverse consequences, could possibly lead to death. So this can be and is a life or death issue, and that's I think why it's just so important that we look to the facts and see that this is really not about safety, it's about money.
Yeah. Is there any data to support either pro or con that enabling third parties to repair medical equipment leads to adverse outcomes?
There's not, right? So I think the definitive study on this was done by ECRI, where they looked at some 2.1 million different basically error logs or complaint reports. I think some from the MOD database as well as other places. And what they found was it's either 0.004% of those over 2 million incident cases were adverse effects that came from third-party repair. So that itself is pretty clear indication that the problem is not quite there. It's worth noting too, right? The manufacturers were pushing for this report, pushing for FDA to look into this, and when they did look into it, what they found was pretty clear.
Yeah. So I just want to push both of you on this topic for a moment, which is, are there any cases where you think that it does make sense for manufacturers only to be repairing? Can you think of any modalities or any cases where you think, they're absolutely right, and for everything over here, we're going to continue to push for right to repair, but there is this one small place where we think the manufacturers are spot on?
I would say, from my standpoint, a new and novel device that's come onto the market that is, complex technology. I certainly, expect, during the warranty period and possibly having a base +4, type of contract on that new and novel equipment. Sometimes in the best interest, as you want to mature a technician, if you have that talent available at your site, to be able to take over, and you would step that down from full service contract, down to a first look, and then on down to even the parts only. I think, to really bring that in-house, not only for cost savings for the hospital, but also, having the technician, under your house, under your hat is a lot easier to be able to get them to come in for service than the manufacturer would be.
And just what I would say is also, I think the manufacturers should be designing technology with repairability in mind, because that's important. That's going to, ensure the maximum uptime. But I think one other area, right, that we have typically kind of excluded from our medical right to repair efforts is implantable devices, right? When you start to get into sterilization and that kind of area, that it becomes, very sensitive, and so that might it's in many cases kind of be outside of the typical comfort zone and experience of a lot of biomeds and clinical engineers. So that is one area that we have excluded from legislation.
That's a point, Kevin, as far as like even engineering it for repairability. I guarantee every technician that's on this call, is thinking, yeah, I could have designed that so much better to be able to access that part, access this assembly. And so it feels like now that there's anti-right to repair engineering that's going on, obviously with software locks, even other things as simple as, not all manufacturers manufacture their parts. They'll source it from somewhere else. And so often when I'm not able to buy the part from the OEM, I'll back source it from their source. And so, a lot of times the parts will have part numbers on there, and but they've begun to cover them up with like foam padding, other things to try to obscure like those part numbers. And we're a little bit smarter than that. We can find those, but they are doing that. That's what it feels like.
Mm-hmm. So you're both starting to get into this question around how right to repair impacts you in an HTM department or broadly at scale in your context, Kevin. So maybe Wesley, we can start with you. What are some of the things that right to repair has impacted within your department, either positively or negatively?
Well, I would say the right to repair movement in general just kind of, opens the discussion more with technicians that have probably either just, discussed it over at the water cooler or over coffee, and it's kind of matriculating up to, actually doing something about it, signing these, getting involved, even myself of going, I can, talk all day I want, all day, all I want about, how things should be, but unless I get involved, it's going to stay the same.
Mm-hmm.
I think that's probably one of the most important things. And then also being able to recognize when we are getting unfair treatment that's unreasonable and not fair.
Yeah. I also wonder too, as hospital margins continue to decline, if there's additional pressure on HTM from an inability to access third parties that increases the overall budget and spend on repairing equipment.
Yeah, I mean, when you have different vendors where your repair strategies are limited, obviously you're going to have to spend more. The downtime, in between is usually a little bit longer unless you have a contract, and then you're favored in that. But if you're a smaller hospital and you can't afford these full service contracts, when you go time and materials, there's actually added cost. You're going to be paying more than you would with a contract, but it's incrementally. And the way that they do that is they'll charge travel costs, travel fees. And some of the travel fees, I just had a very, very terse discussion with a vendor about travel fees. They were charging $1,375 per hour. And they were going to charge us two of those charges, two machines at the same location. So here I was, and I went on to my Turo app, and I said, well, I can rent you a Bentley for $300 for the entire day. I'll hire you a driver at $50 an hour, so that's another $400. So that's $700 for my driver with a Bentley to drive your technician around all day long. So how can you convey the value to that? Well, really, to me, what that is that's a paywall. Between having a contract and not, and that's when the director, does the cost analysis of, am I going to have this under contract or not? This is where the OEMs throw in that added cost to bump it up to make it more advantageous to go with the contract.
Yeah. Wow.
And, to add to that, right? I think this is a problem for bigger hospital networks like Banner, but also I've spoken to a lot of biomeds and clinical engineers from rural hospitals, smaller hospitals, right, that are in way up in the North Country in Wisconsin or Minnesota that are sometimes 5 to 8 hours drive from the nearest metro center where the manufacturer technician is going to be located, right? And so yes, there's the cost, and then you talk about they're charging $13.75 an hour for 8 hours. That's out of hand. But also there's just that weight, and when you have less beds, when you have less equipment, You can't afford to just wait that long, have them come up, work for a couple hours, and then have to head back before they come back the next day. So there are just all sorts of problems, and it just, that's, I think, a big part of this Right to Repair campaign is to make sure that there is a robust repair environment out there, so that there are options. So you're not locked into a high contract, you're not locked into a long wait to get the service done. You've got places you can turn, and there's some redundancy there, so you can get the job done.
Yeah. And I love that you brought it back to the patient, Kevin, because I think that that's what this conversation is really about, is how do we optimize for the patient so that we can drive the best outcomes and ultimately lower the cost of care as well, if that's possible. And I think that brings us to the last question I had for both of you today, which is around recommendations on what we as audience members can do to support Right to Repair. What strategies and solutions do you recommend to take action and make a difference? And Kevin, maybe we'll start with you.
Yeah, so I think, first of all, is just understanding the power of your voice, right? As someone who is dealing with this problem, who is seeing the problems in action, seeing the impacts that are coming to, hospitals, to the cost of healthcare, to the care that is delivered to patients. So for one, just getting involved, right? I know at the end here, we're gonna put up a slide with some different things that you can do. One of which is signing a letter, just indicating your support for Right to Repair, getting involved in state and federal efforts to get this work done. So that's the QR code and number 3 there. Additionally, right, joining the conversation on LinkedIn. But number 2, I think, is important as well, is just documenting incidents as they occur. As we go, and whether it's in DC or in Sacramento or in Springfield, Illinois, wherever we're pursuing these efforts, having actual incidents, cases, the facts. We don't necessarily want to name names, but we need to know exactly what the facts are of how it happened, how long of a wait you had, how long it took to get those things done. So keeping track of those things, and then speaking out, sharing your story, because in addition to, right, we want to have the facts on our side, and we need to go into these places to convince decision makers and legislators to act. We also need to win in the court of public opinion, because manufacturers can pay for the best connected and most expensive lobbyists there are. So building that public support starts with your stories, and so sharing those are incredibly important.
Wesley?
Well, just to echo, if you see something, say something. You have to actively fight for your right to repair. And report delays or non-service from OEMs, and make sure your voice is heard. This is going to help us frame, factually frame our narrative to be able to, combat the narrative that's being, proposed by the OEMs to the public and to, the legislators out there that are going to be voting on these bills, and, that are going to put it into law and force the OEMs to be able to, allow us to repair the equipment that we have bought and purchased. And, you can also vote with your capital dollars, right? So you hold the power when you hold your money. But once you give it to the vendors, now it's theirs to do. And, if they verbally tell you, hey, yeah, I can get you some service manuals, don't trust it. Trust but verify. Put that into even creating your own local policy with your hospital to go, hey, salesperson from random OEM, I have to have 2 service manuals and a service school added onto this contract as a no-cost line item. That's just part of our policy. So if you'd like to do business here, this is how it's going to be. Things like that really kind of nip it in the bud before they have your money, because that's what they want. You have that power before, they have the power to restrict those things from you. I would say also,
sorry, Wesley, go ahead.
I would say also, my last point on that one would be to engage with your hospital leadership, from a technician to, your shop foreman or your senior manager to the director, and then on up to the C-suite to really, promote and say, this is why this is important for us, from a patient care standpoint, first and, foremost. Secondly, from the bottom line. And that bottom line actually allows us, especially for a nonprofit system, to be able to allow more care to more people as well and make it easier.
I was just going to say, I hope when we go back and edit this before we put it on YouTube, we put some Beastie Boys over Wesley saying we need to fight for a right to repair.
I was thinking the same thing. Fight for your right to repair. Well, thank you both. I think that these are some really fantastic insights and recommendations, and I've learned something from both of you, and I appreciate the great perspectives and the deep perspectives and expertise that you have brought to the conversation today. I know that we have gotten a lot of great questions submitted ahead of time from some of you on the webinar, and perhaps as well while we've been talking. So with that, I'll hand it back to Linda to moderate the next part of the discussion.
Great. Thank you so much, Kelly. Yes, we've got quite a few questions. The first question that's come in, how does the right to repair movement address traceability and competency issues?
Well, I can start off with that one, Kevin, and then I think you could probably back me up. So the traceability and competency, I think is important with medical equipment. How I take that, maybe I'm a little bit off, but from my side, traceability would be, who's worked on that equipment, what's the history of that. Every hospital should have a history in their CMMS on that piece of equipment, which should have technicians tied to it, whether it's the OEM or the trained technician at your site. And then obviously the competency of those technicians. So another part is, you can't always trust that the OEM, who they're sending in, is actually competent on the device that they're showing up for. I often had issues when I was in Hawaii at the medical center I worked there for the military, and they would routinely send over an MRI trained technician to address our cath lab issues. And obviously, magnetic resonance and ionizing radiation are two different things, as well as, those are different complex systems, and they would absolutely tell us that, we are not, trained on it, so we shouldn't be working on it. Well, neither was their technician. So having a policy in there where, it says the technician, any outside technicians must have a certificate of training on the equipment that they are coming into the facility for, I think would also help out a lot.
And again, that's a reason that it's so important that this information is available. If the training's available, then that, and there isn't a gatekeeper to that training, that makes it so much easier to make sure that, hey, Wesley or one of his team can get trained up and know how to deal with, the particular equipment that they're dealing with, rather than having to worry about a manufacturer actually being, qualified to do it. But the other thing I'd add, as far as kind of the traceability and competency aspect, right, is it's important to remember that there are requirements of hospitals through, Center for Medicare and Medicaid Services to keep records of the repairs that are happening, right? So that is already in place, as well as making sure that the technicians that they are either employing or hiring, through ISOs, are competent and keeping up with continuous education. So, that is built into the system. We're not trying to reinvent the wheel as that goes when it comes to medical right to repair, but nonetheless, it's important, and it's important that hospitals continue to execute on it.
Yeah, that's a good point, Kevin. We're routinely accused of being unregulated, and they'll say, that they're regulated by the FDA and we're not. Well, that's conflating two different issues. Yes, they are regulated by the FDA, and we aren't necessarily, but we are regulated by CMS, whether you're under TJC or DNV, you have CAT, AABB, I could go on and on. We all know NFPA 99 and 101, and all the life safety codes. There is a boundless stream of regulatory guidance, some that we follow voluntarily as well.
Okay.
Absolutely. All the alphabet soup there, but sorry, go ahead, Linda.
Oh, no, I was just going to come in with the next question, but please finish, Kevin.
No, yeah, I just think that's a really important point. That's one of the arguments we hear most often, is like, well, these parties aren't FDA regulated, and that's because they're not medical device manufacturers, and they shouldn't be, right? So we have the regulation structure in place. We need to rely on it. It's, as the FDA's research is showing, it's doing the job that it needs to do. So we just need to continue on that path.
Great. We've actually had quite a few questions about third-party parts. So what about ability to use third-party parts in medical devices? One company sent a letter saying no.
Well, I think first of all, I think this is one area where software and the introduction of software has kind of impacted this. So I'm not an expert on exactly what third-party parts are the best or how they need to be used, but what I do know is about how the technology works. And believe it or not, I know you didn't expect to hear about Britney Spears, but we're going to go to Britney Spears. So this goes back to a piece of legislation that was passed, I think in the late 90s, called the Digital Millennium Copyright Act. And what this was meant for, right, is when people were illegally downloading, or at the time legally, but downloading Britney Spears songs for free, she wasn't getting her cut. They wanted to make sure that there were technological protection measures, which is the technical term for basically digital locks, so that it could be sold and then the artist could get what they were due as a result of it. But as time has gone on, manufacturers of all sorts of devices, not just medical equipment, but agricultural equipment, consumer devices, have basically made it a copyright crime for you to fix your stuff, right? They've hidden repair behind these technological protection measures, which is just crazy, right? Repair is not a crime. It's not a copyright crime, that's for sure. And so the Copyright Office has come in and said, we think we agree with this case, and technically you are, as the owner of your equipment, are enabled to go in and hack your device and install parts that then you can pair to the device, right, which is a big part of it. But it can be difficult for, manufacturer or third parties can't sell diagnostic equipment. They can't go and create their own competitive tool. And then I think in some cases, right, parts they're not able to pair the part to the device. So it gets a little bit technical and wonky there for a bit, but the comparison I would make is if your check engine light shows up on your truck, right, you can take it to the dealer, you can go to the manufacturer, you can walk into an AutoZone or an O'Reilly Auto Parts, no affiliation, and buy a Snap-on tool, right, for $90 that you can plug in and see what the problems are with your device. Because of the DMCA, that does not yet exist. That doesn't exist for medical devices and other types. So one area we're trying to pursue this is through the Freedom to Repair Act, which was introduced by Reps Mondaire Jones and Victoria Spartz. It was a bipartisan bill that would make changes to the DMCA to make sure that this could happen in the future, to make sure that there is, again, a more robust and competitive environment for parts for diagnostic tools and the like. But that's a little bit of the technical side. Wesley, maybe you can talk a little bit more about kind of your experience from the on the ground side.
Yeah, I think as far as third-party parts go, as long as they are the similar dimensions and makeup, like as the same alloy mix, though that's really what I would care about, and the functionality. And sometimes even the third-party parts will outlast some of the OEM parts, because they're going to come in and make them better. You look at some of the performance parts that are available for, motor vehicles now, and they vastly outperform the OEM parts by design, But I would say as long as, there is, I would feel comfortable, with certain, third-party parts, as long as they're manufactured within the same specifications. And then especially, if the vendor itself, the OEM itself is unwilling to produce any more of those parts, then I feel like, their time on that copyright is done. And, that information should be made public. And if other companies want to follow that and produce those repair parts, for that equipment, then they should be able to. Just keep that equipment out of our landfills and other countries' landfills. I don't think that's right either, to be sending all this equipment to these other countries, sometimes under the guise of here, we're donating this equipment, and then they won't provide them the support from manuals to repair parts and the like. Really, it's just a dump.
There's a really tragic story about incubators being basically donated to Tanzania, and because they couldn't get access to service keys, repair manuals, etc., they're just landfilled, right? And that's just tragic. But I think one other piece of having the ability to use third-party parts, provided again same specifications, same dimensions fulfilling the same purpose, is another case where that helps with resilience in times of supply chain weaknesses like we've seen during the pandemic. If there are more, options that you can turn to, it means it's more likely that you're going to be able to get access to that and to fix the equipment that you need to fix.
Or even having the OEMs partner with these third-party firms to be able to, increase their supply, because that's it. We're seeing right now there's parts and PM kits that are on quite the long back order, and people are even considering buying different devices because they know that we have this whole fleet. We wouldn't have replaced it right now, but you know what? Because we can't get repair parts and it doesn't look like the foreseeable future is going to, look any better, that they're making those capital decisions, and then all that equipment's going somewhere else too.
Okay, and another question that's come in. Do you feel that C-suites have a clue about what's going on with right to repair?
I would say that's a mixed bag. It depends on the directors and how involved they've been, how involved they've been even with their C-suite. I would imagine most directors are. You have to solve a variety of problems and put out fires on a daily basis. But if you haven't had time to communicate that this is what is giving you a hindrance, and I'm sure each and every director or even biomed out there has gone, hey, department, hey, CFO, COO, we're not able to get this back up because we're waiting on the OEM to either show up, waiting on them to get parts, availability. And, I don't know how much longer an excuse for COVID is going to last, whether it's real or, that's just going to continue to be the mouthpiece until we're all tired of hearing it. Because I'm like, healthcare's got to keep going, we can't use that excuse forever for parts backlogs and things like that. It's just unsustainable.
And Wesley, to your point, right, that is another area where all of you who are watching can get involved and make a difference on this, right, is bringing to your leadership, whether it's your direct report or, all the way up the ladder, saying, look, this is a problem for us, talking about how it's a problem, talking about the delays you're facing, the extra money you're paying, all of those things, right? And we've seen this work. This is how we've been able to make progress, how we've gotten, hundreds of hospitals. I think, recently we had a letter signed by hospital networks with a combined 251 hospital locations across the country, right? Is because there was a biomed, a clinical engineer, an HTM who spoke to their leadership, and their leadership, put it up the ladder and said, we need to support this. So I hope this is an area where you feel empowered to go and have conversations about this, because that is so critical, and ultimately that's the way that we're going to be able to win this effort.
Yeah, and I think once you can get your hospital's administration or leadership on board, and then utilizing that as a tool with your local legislators, because sometimes they hold a little bit more sway, when those local legislators, lawmakers are, looking at the area, say here in Arizona, and they go, well, can you guys put a hospital here because we really need that support for the community? And that's a good opportunity for your leadership, the C-suite, who's making those, going, yeah, I think we can do that. This is a community that needs to be served, and we'd really love your support for the right to repair as well, and I think that kind of matriculates up as far as the influence goes, because that's ultimately whose influence we need, and it's kind of disappointing that some of the opposition, one of the heads of the opposition groups is actually a lawmaker.
Yeah, we see a lot of that. And one thing I'll add to that, right, is I hope that you'll reach out to me and use me as a conduit from, you, your leadership team, your hospital, to the legislators, right? That's where our expertise comes in, is doing the policy research and then going out and advocating and organizing and, kind of connecting lawmakers with their constituents, with the hospitals in their districts, and talking about this issue, right? So we've got, decades of policy experience, and we want to help you to get this done because, like I said, we're a nonprofit. We're not selling anything. We're not making anything. What we're trying to do is make some social change. We're trying to do what's right for the public health, and for the cost of healthcare and all those kind of things. So don't hesitate. I'm sure my contact information will go out, but please reach out, and I'd love to work with you to help get that done.
Well, I want to say thank you both again. This has been an incredible discussion, and I thank our attendees as well for sending such great questions. We just wanted to end by putting up our contact information for anybody who wants to reach out. We also shared the ways that you can get involved earlier, but thank you again. I hope that this was worthwhile for those of you in the audience, and we look forward to reconnecting with you on another webinar soon.
Great, thank you so much, Kelly. Actually, to the attendees that submitted questions, I will be forwarding them to Kevin and Wesley, so please be patient for their reply. So I just want to say thank you on behalf of Webinar Wednesday to Kelly, Kevin and Wesley for your time today and for a really great and informative presentation. I'd also like to encourage everyone to visit today's sponsor, PartsSource, to learn more about their products that they provide to the industry. So visit partsource.com. As promised, the answer to today's trivia question was Steven Spielberg. So congratulations to our winner, Robert Millwood. Enjoy your t-shirt. Just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. Thank you once again for joining us. Enjoy the rest of your day, and we'll see you another time.
Thank you.